Hello and welcome, and a very good evening to all City Spidey TV viewers to this time's episode of ENT Talks. We have an eminent panel with us today, and we are going to discuss impairment and cochlear implants. And we have eminent ENT surgeons and doctors from all over India today. We have our very own, very special Dr. Kalpana Nagpal. Besides being a robotic surgeon and a senior consultant with Apollo Indraprasth Hospital, she is also the president of Indian Women Otolaryngologists Association. It's an association of ENT specialists, surgeons from all over India. We also have more eminent guests. We have Dr. Renu Rajguru, and Renu Rajguru is the director of ENT in 15th Air Force Hospital at Jaisalmer from Rajasthan. And Dr. Hetal Marsatia Patel joins from my parent city, which is Mumbai. She's professor and head of State GS Medical College and KEM Hospital. A very, very warm welcome to all of you. What the topic that we are
Thank you.
discussing today is of immense interest for all of us. Even as I speak, we talk about binging, we talk about the impact of OTT on our lives, and even otherwise, hearing and taking care of this very important faculty of yours. So when it enters the area of impairment, okay, and when can we or how can we use technology to correct this impairment is our larger focus, and then we will also look at specific issues. So having started and introduced all the wonderful guests, I now throw open the stage to Dr. Kalpana Nagpal to tell us about this organization, this association, at the same time tell our viewers about how hearing impairment impacts our hearing and our day-to-day life.
Thanks, Ketan.
Dr. Kalpana, over to you.
Thanks, Ketan, and thanks to City Spidey for giving us this opportunity, giving us this platform. And we're looking forward to having such sessions every week. Now, I welcome the two stalwarts
Pleasure is
here.
ours.
Yeah, Dr. Hetal Marfatia Patel, who's the director of KEM Medical College, head of the department ENT, and she has a lot of laurels in, she has too many feathers in her hat. It's very difficult to describe her in the coming 5 minutes, but I'll still tell you that she is specialized in laryngology, in sinus surgery, in cochlear implants, and many, many more. And she's got more 27 years of vast experience in KEM Hospital, Mumbai, dealing with complicated cases. And it's a hospital which deals with they have footfalls of more than 100 every day. And she's been doing cochlear implant surgeries for a long time now. And of course, this is one of the aspects of treating hearing impaired children or adults. And now we'll introduce Renu Rajguru also. She's also a product of KEM, and she's also been doing cochlear implant surgeries, and she was trained in Bangalore, Command Hospital, Bangalore, and then she's now doing it at Air Force Hospital, Jaisalmer. Now, welcome to the two of you. Now, being a robotic surgeon, I'm looking forward to having robotic cochlear implant surgery very soon. So far, we're only doing it for head and neck cases, throat cases, basically, and TORS, like transoral robotic surgery, etc. And well, now today's topic is actually very important because hearing impairment is a very common issue. And all of us as ENT surgeons, one thing exciting, Ketan, I must tell you is, since the time we have formed this organization, it is so lovely to know each one of these ladies who are doing such excellent work in their respective fields. We never knew each other. We just, know that there are about 500 to 700 women ENT surgeons who are doing regular surgeries within the country. But really, it was so hard to know who's doing what. And now, knowing each other, socially and their professional lives, it's been very exciting, and looking forward to a great relationship with each one of them. And now, hearing impairment is a very common presentation in the ENT clinics. All of us have a lot of patients coming with hearing impairment, whether it's a child, whether it's an adult. It can be sudden loss, it can be, disability for a long time. Now, deafness is what? it's complete loss of hearing. So it's a disability, right? Now you have many millions of people. Now these people are going to tell us the exact statistics. We have millions of people who are suffering from, deafness. And, just imagine living in the world of no sound. It is really sad. Look at the family who's going through all this stress, having even one member who is not able to hear properly because the communication skill, thereafter goes for a six. So you're not able to understand anything if your sound clarity is not there. And it indirectly affects the linguistic skills, and then it affects your psychological well-being. So there's so many things that hearing impairment can indirectly do to an individual. So today we will try to understand what is hearing impairment, like the deafness. Is it different from hearing impairment? What I mean is, partial hearing impairment or total hearing impairment, which is deafness. Well, how does it differ, and how do you qualify? What are the definitions, and what are the treatment aspects? That is what the public wants to know. Any current technologies, anything new? What do we offer? Because there are a lot of people in the rural sector, especially, they're deaf from childhood. Like, even there are countries like Afghanistan and Nepal, we have patients coming in with deafness, and they do not know what to do. And there are, they have deafness since childhood, since birth, and they haven't done anything for even till 17 years, 20 years, and then they come to us asking for some help. So it is so sad, and that is why today we are taking this initiative to create awareness. So first, let's start with Dr. Hetal, who has so much experience. So, Dr. Hetal, please tell us, what is exactly prelingual deafness and postlingual deafness? What is the difference?
Prelingual is the one, if you are born with the deafness, then it is known as prelingual, because hearing is one of the necessity for developing speech. So these patients who are deaf from birth are not even able to speak. So they are known as prelingual deaf. While those like you and me, once we have heard the sound, once we have learned how to speak, and for some reason, if we lose the hearing, then it is known as postlingual deafness. The postlingual deafness could occur because of any trauma, any infection, any viral infection, mumps, measles, rubella, all that can cause hearing loss after you have acquired hearing and speech. You can have meningitis, which can lose your hearing. You can have some autoimmune disease by which you can lose hearing. By some autotoxic drugs, you can lose hearing, or by simple aging, you can lose hearing. So these are the patients, those who know how to speak and then have lost the hearing. Those are known as postlingual deaf patients.
Right. I hope the viewers are able to understand everything she's explained so clearly. Now, Dr. Renu, what do you think, how many children, or what is the percentage of hearing impairment, or rather, I should say, what is the percentage of deafness in the world? Or if you have statistics within India, please let us know.
Yeah, so it is as per the statistics, 3 to 5 babies per 1,000 live babies are supposed to be suffering from some sort of hearing impairment. And as they become older, the number further increases, which means like 5 babies per 1,000 babies will have hearing impairment. So this is a huge figure. And worldwide, it is believed that it is 34 million children are hearing impaired. And if we consider the total population, 466 million population people are hearing impaired. So it's a huge problem. And it is very important that, these children who are born deaf are caught at a very early stage in their lives so that a meaningful intervention is possible.
Right. So, Dr. Hetal, now, what are the kind of tests that you perform regularly when a person comes to you with hearing impairment? So, in children and in adults, I'm sure you have a large audiometry setup in your, audiological setup in your center. including different types of audiometry, etc. So please elaborate for our viewers so that they understand this.
See, if you know that there is a deafness in the baby, and if you are doing the test, that means then you require a BERA to brainstem evoke response audiometry to confirm that there is deafness. But rather than child coming to you with deafness, we should switch to a neonatal hearing screening program, and neonatal hearing screening should be made compulsory all over the nation. Likewise, it is there in the Western world that every baby which is born should be screened for hearing. So if I can make one single request to all viewer, that any baby which is born around us, if we request them to get a simple hearing screening test done, that is OAE, it takes less than 10 minutes, and it can be done at bedside, and it can tell us whether the baby is having normal hearing or baby has hearing issues. And in our country, every high risk baby is undergoing this OAE. But our every single newborn should be screened for neonatal hearing screening, and then we will be able to pick them up early. Otherwise, when we wait for child to come to us or parents to come to us for deafness, that means the baby has grown quite a bit. It comes to us only when they don't speak, or when the parents realize that despite of a loud sound the child doesn't startle, so there is a delay in diagnosis. So if I can send one single message to all my viewer that every single baby born should be screened for hearing, then I've made my day.
Ketan,
Surely.
here I
Yeah.
would like to say Dr. Hetal has made a very important point. Like in Apollo
Absolutely.
Hospital also we have this neonatal screening, but not all centers have it. So please, we want to send this message across to the
Yes,
ministries, central ministry as well as state ministries, that every hospital should have this neonatal screening system, because acoustic emissions, it's a small test. It takes only few seconds. And
true.
so, Ketan, please, please send this across, this message
That is,
to
that is
only
also
going
so
in from our
important because
organization.
absolutely, and that is such so important because
I
at
would,
what stage of hearing loss is the child? You can just with a small test like that, one can know at what stage of hearing loss or no hearing loss is the child, and so that is so crucial. One question at the outset, because we have started talking about hearing loss, that plagues everyone, is that if you are diagnosed with hearing loss at birth, then ultimately the muteness is hyphenated with hearing loss. So how do you connect both? And even with partial or complete hearing loss, what is the chance of a person becoming mute?
Yeah,
Every
Doctor,
single, if you want to uh, prevent that deaf child from becoming mute, you must treat the deafness on time, intervene on time, and then we can have that child which is deaf, which otherwise would have been mute, get into them into a normal stream and get them a speaking child. So for that, it's very important that we identify deafness, we intervene on time, do cochlear implant if the need be, and then get that child into speaking child.
absolutely right.
yes,
Renu, you
I
wanted to
just
add
want to,
something.
yeah, I wanted to add here something. Our government has started this program in 2007, National Program for Prevention of Deafness. And universal newborn hearing screening is a part of it. So I have this hearing screener. It is such a small, simple instrument, and it has this simple probe which has to be inserted in the ear. It gives a sound, and based on the ecosystem, it picks up the sound. And if the hearing is normal, it will show as pass. If the hearing loss is more than 30 decibel, then it would show as refer, which means that we should go ahead and do a definitive test later. So this is a very important thing. Of that means, like, we have to screen all newborns, and to pick up deafness early for an earlier intervention.
Right.
So as you can see, it is just a non-invasive, very simple test. You have to put a probe, give a sound, collect the sound, and see the result. So that's it. It can be done in the pediatric ward. It can be just sound. We may not have a sound-proof room, but a silent room is also good enough.
It's so important for early detection of muteness, and the test is so simple. Dr. Kalpana, can we move to the second part? Is like once
Yeah,
we
I
have
wanted to
diagnosed.
say now, since we started about timely screening for the newborn and timely detection of deafness before they become mute, as Hetal said, we also have to understand that we could prevent deafness even in adults. There are a lot of underlying diseases sometimes, like for example, uncontrolled diabetes. How many do take care of this, and how many know that diabetes actually affects the inner ears? So like that, for example, Dr. Hetal mentioned ototoxicity as one of the causes, which means drug-induced hearing loss. So now anybody who's on ATT treatment, they have to undergo serial audiometries, and also they should know which drugs to give, which not to give, preferably, unless sometimes you need streptomycin to be given. But does the patient patient's awareness is very, very important, and screening audiometry is important, and repeated following audiometry is important, follow-ups. So, so many things like this. For example, a lot of people who develop sudden hearing loss, which we call it as sudden sensorineural hearing loss, but present to you after 2 weeks or after a month, without even knowing that initial 1 week or 10 days is very important, because there is a good chance that they would recover completely. Otherwise, they would, tend to be having permanent disability. So, Dr. Hetal, now let us find out, if somebody comes to you with deafness after doing complete investigations, you've confirmed, and now what exactly are you going to offer them? Are you going to be offering hearing aids, and are you going to be offering some surgery like cochlear implant surgery, or you're going to be obviously following a certain protocol? So please
Yes.
let us know, so that the public is aware that what exact protocols do we
So
have
if
to
I
offer.
come to know the child has got deafness on BERA, then I would definitely very closely work with the parents, counsel them that intervening this deafness is extremely important, because that is where we will be able to offer them good treatment and get the child into normal stream if we intervene them on time. So my protocol as far as this child is concerned, that I always uh, request them to put a hearing aid. My audiologists work very closely with them, so that we come to know whether the child is wearing hearing aid or not. Child gets used to wearing hearing aid, and we start the uh, auditory verbal therapy using a hearing aid to begin with. We always give a chance for we at least 6 weeks to 3 months the child has to wear the hearing aid, and in the meanwhile we tell them that this child may require cochlear implant. So parents are aware that they will have to collect for funds, they will have to arrange for the money, because cochlear implant is expensive affair. So you have to give little time for patient to accept it, that this may be needed, and give some time for them to collect the funds also. So during this 6 weeks to 3 months period, the child is closely working with our audiologist, starting the auditory verbal therapy, and also in the meanwhile we work with our pediatrician to rule out that there is no other abnormality with the child. We do the 2D echo and ultrasound abdomen, because we have seen that with congenital deafness you can have associated anomalies. So we rule out that, and we also vaccinate the child, and for basically meningococcal and pneumococcal vaccination, so that if in future the child is required to do cochlear implant, then child is, we don't lose time at that time. And once we also get the HRCT and MRI temporal bone done, to ensure that the development of the cochlea is good and the auditory nerves are present, so that if the cochlear anatomy is good and the auditory nerve is present, then only then we can consider this child for cochlear implant. So this is as far as our protocol is concerned.
And Renu, what about school-going children, toddlers? Lot many times we do screen otitis media with diffusion. In fact, there are ICMR projects also. Even when I was doing my post-graduation, even I did a project on that.
affecting each and every
Is there a
part.
background
So,
sound?
देखें।
Sorry,
Well,
the others
Sunny,
keep your
one of
phones,
the
microphones muted, please.
has intermittently joined unknowingly. Please log yourself out. We are currently live on Facebook. Go to the City Spidey page, like, share, subscribe, and go to the City Spidey page to watch this live. We have three eminent panelists: Dr. Kalpana Nagpal, Dr. Renu Rajguru, and Dr. Hetal Marfatia Patel. So,
So,
if
yeah,
someone
so
has
Renu,
inadvertently joined,
Yeah.
Renu, I would like
Sure.
you to
Carry on.
highlight about this middle ear effusion. Yeah, so because lot many people again have delayed presentation, which could indirectly lead to again hearing impairment.
Absolutely. So middle ear effusion is a cause of, which can be easily prevented or treated. It is easy to identify and treat the cause. So it's very important that parents and teachers pay attention to the child. If it is found that child has suddenly started, not paying attention in the class, or increases the TV volume to a very high volume, or doesn't respond to the teacher, or doesn't respond to the parent, it is important that the parent is aware it's a purely psychological issue or an attention deficit. They have to pay attention to that hearing. So it is very important that they are brought to the ENT center as early as possible, so that they can be examined and treated, and the result not able to follow anything in the class, they may become a class topper. And
Yes.
it is and other associated causes, like what led to otitis media with diffusion, was it adenoids? Those things also have to be treated simultaneously.
Right. Good points for the viewers to remember that, inattention in the class, or sometimes, even psychiatrists would have referred you cases like ADHD, etc. Now, very, very important to screen these children on time. So all these people, especially the viewers, have to know that we have different types of hearing loss. Like we have conductive hearing loss, which we have sensorineural hearing loss, we have mixed hearing loss, which means what I'm trying to say is certain categories of hearing loss can be treated with much simpler methods. Some of the hearing losses can be treated with simple conservative method. They don't have to go for surgery. Or sometimes they need simple surgery like putting in grommets. We call it myringotomy. So cochlear implants and hearing aids, no, these are for sensorineural hearing loss, because sensorineural hearing loss is something which cannot be recovered by giving medicines or giving some conservative treatment. So that is why it's very important, as the history Dr. Renu said, viewers, please remember, inattention in the class or increasing their volume, or asking for repeated, they keep asking you to repeat. So that's when you should suspect that your family member is suffering from hearing loss. It could be an elderly individual, or it can be somebody who's asking you to repeat, or missing certain letters, or the speech is suddenly altered. So you need to find out when exactly this is happening and take them to the doctor. Now, Dr. Hetal, so
Yeah.
what kinds of hearing aids do we have, and do we have what are the advances that have happened recently, and so that patients know that these kind of things are possible now, and patients have great satisfaction level with like, for example, a lot of people come with tinnitus and they do not know that tinnitus masking is available. People have been having certain medications for a long time, months and years, and they're so depressed with tinnitus, but they do not know that tinnitus with hearing loss have a lot of remedies. So, Dr. Hetal, please tell us about hearing aids.
There are various kind of hearing aids. You have body-worn hearing aid, which are almost outdated at this moment, and you have behind the ear hearing aid. You have in the canal hearing aid. And there are these in the canal hearing aids are almost invisible hearing aid, where people cannot make out that how is that the patient is wearing a hearing aid. There are one more, you can also have a bone conduction hearing aid, and you have they are available in the form of spectacle also. So they can be worn like a spectacle. So you have variety of hearing aid. One very important thing to be understood as far as the difference between the hearing aid and implant is concerned, that hearing aid is used if there is an existing hearing present. So hearing aid does the job of amplification of hearing. So for hearing aid to be used, person has to have some hearing. If there's a complete loss of hearing,
Oh,
the hearing aid may not help, and because there is nothing for it to
There's no reserve.
or there's nothing for you to uh, make it louder. So basically the job of hearing is to make it amplified, the sound. Now in the present era you have digital hearing aids which can be digitalized as per your need. Suppose whichever frequency you have deafness, only that frequency deafness can be corrected, and your natural hearing, suppose if you have a low frequency maintained, then that can be kept lower and higher frequency can be increased. So basically hearing aid can be tailored to your requirement, provided you have a good audiologist who will do good tuning of the hearing aid. So it is very important because there
sure.
are a lot of people who want to
So
sell
for all
hearing
the
aid,
viewers,
market hearing aid. But if you have the right person to tune your hearing aid, rather than buying the hearing aid and keeping it in the drawer, you will use it. So I always insist that first there is very important counseling required, that we have to explain to the patient that you have to use the hearing aid, because you may not feel that there is a need, but the entire quality of life can be improved by using the hearing aid. And we are buying this hearing aid not for show or putting it in the cupboard, or it should not interfere with your cosmesis, but actually to improve your hearing. And it should be very nicely tight, uh, very nicely programmed so that they can use it very well.
Yeah. Thanks, Dr.
that's a
Hazel.
very important information, Dr. Nathan. I would just like to intervene and ask our viewers. Okay, we are joined with an eminent panel of ENT surgeons from all over India. Dr. Kalpana Nagpal, Dr. Renu Rajguru, and Dr. Hetal Marfatia Patel. We are talking about impairment today. So if you have any questions related to hearing impairment and cochlear implants, please ask those questions to this eminent panel. And one question, again, as a community platform, I'm asking you, everyone these days is subjected to various uh, earpods and hearing aids, and people are going on the OTT platform, they are binging. So how much exposure to sound directly in your ear can impact your hearing is something that all of us here want to listen from you.
Yeah,
You.
Dr. Renu,
So
that's a
Dr.
very
Kalpana.
valid question because a lot of children are using these earpods all day, especially with these online classes. So a lot of parents coming with children. So please do take the
Absolutely.
question and tell us, yeah.
Yeah, you're very right. It is very sad to know that, see, initially what used to be the norm, that it would be the older people who would come to us with sensory neural hearing loss. But nowadays, it is the younger people who are coming with sensory neural hearing loss, and that is because of the noise induced hearing loss, which they have caused to themselves and which is highly preventable. I know this firsthand because we do medicals, and I mean, we examine audiograms of young people when they are recruited in the army or defense forces, and we have an objective evidence that it is the younger generation now which is coming up with sensory neural hearing loss, and which could have been avoided had there been some knowledge about it. So this our viewers should take home this message, that noise induced hearing loss, it's not possible to treat it, but it is very much possible to prevent it. And once hearing impairment has set in, then you become unfit for many employment opportunities.
Right. Dr. Hetal, now since you have an excellent experience in cochlear implant surgeries, Ketan, how many do we have? We have very few cochlear implant surgeons in India, and to have women cochlear implant surgeons, we must.
Oh,
It's a great
that's interesting
applause
to
for.
know.
So now
Mhm.
we'll have to ask Hetal about what are the costs for these cochlear implant surgery, and do you perform bilateral implant surgeries, which means implants for both the ears at the same time, or you take up only one at a time? Please tell us all this.
Uh, you doing bilateral cochlear implant is extremely ideal because the way we require two legs to walk, two hands to do our work, we require two ears to function normally. People may not realize it. We can always walk with one leg also, but we are limping. You can do your work with one hand also, but then it takes double the time, and some of the work you can't do. Same way with one-sided hearing. This is bilateral hearing loss, where a lot of people do only one-sided cochlear implant. It is only because the cost is what is preventing us from doing it. If patient can afford, the ideal thing to would be to do bilateral cochlear implant. If patient has money and child is fit and child is well developed, then we prefer to do the bilateral cochlear implant at the same sitting. But for some medical reason, if the child is very low birth baby and you don't want prolonged anesthesia, or there are some issues, then only then you uh, offer them the sequential bilateral cochlear implant. If you have the gap of 3 to 6 months between the two cochlear implants, then it is still functions as good as the bilateral implant done at the same sitting. But in my setup, large number of patients are undergo only unilateral cochlear implant because a lot of my patients are from low socioeconomical class and they undergo cochlear implant through funding, because none of our insurance agencies give money for cochlear implant, saying that it is a congenital deafness. So anything which is from birth is not covered under insurance, and they do not give money for the implant per se. The basic implant itself costs 6,09,000 rupees. So how we have different models in car like Maruti, Mercedes, BMW, like that we also have it in cochlear implant. We have a basic implant, then we have more sophisticated implant, and we have very sophisticated implant, and we have some of the implants which are off the ear, because to explain to the people that cochlear implant has got two parts. One part is the part which is put during surgery, and then there is an external component which has to be worn by the patient. A lot of patients who come to us feel that once the surgery is done, they will not have to wear anything outside. So we have to basically counsel them that every time there'll be something which is worn outside, because the speech processor and the mic and all is worn outside, while uh, the actual electrical circuit and implant is within the inner ear.
So are you conducting a fellowship course, Dr. Hetal? This is for our
I
young junior colleagues who
Yes,
want to
we
go for
have a
this.
fellowship for otology. We have not specialized that into a cochlear implant fellowship because in none of the university hospital the cochlear implants were done, and I did not want my fellowship to get rejected and have issues. So we have put under the wide name of
Banner of
uh,
fellowship in otology.
in otology, which is very well accepted, and there is almost every OT there is an implant done. So anybody who comes has a good exposure to not only the other otological surgery, but it is also cochlear implant.
So what is the waiting list kind, Dr. Hetal, for the patients?
Uh, the waiting list, we don't have a very long waiting list because something or the other goes wrong in the, but we do have waiting list for over a month or so, because now my team is very strong. My all the co-faculties are also performing the implant. So, and there was a time when we had OT for a very limited period because I was using a transplant theater for doing my cochlear implant, because my OT is under renovation. So that time we started doing one after the other two implants. So our speed increased, our uh, time and recovery time improved. So there are times when we are doing two implants in a day, or we are doing bilateral implants. So we don't have a very long waiting list, because by the time patients can arrange money, vaccination and all that, there are a lot of patients in the pipeline, but we
Right.
don't have a very long waiting.
Good to know that. And I'm sure the junior colleagues listening to this talk, they'll be impressed and one day would probably get an opportunity to watch you doing cochlear implant surgeries. And Dr. Renu, of
Definitely, Dr.
course,
Kalpana.
in the armed forces, Air Force, like whether it is
Yeah.
Armed Force, Air Force, or Navy, again, you have very few cochlear implant surgeons. And so Dr. Renu is one of them, and she's in Jaisalmer. So people from North India can go and watch her doing, and also, let us know from Renu about her first experience in the training program at
Doctor,
Pune
I
Hospital.
would like to ask one question. Yes, I would like to ask one question to Dr. Renu that he's at the Air Force station, and what it is like to be an ENT surgeon in a, I wouldn't say in a warlike situation, but what's the difference between a civilian hospital and a military hospital, being an ENT in both these places? And we are also coming almost close to our time for today's show. So over to you, Dr. Renu.
So the work experience, the job is the same. An ENT specialist is an ENT specialist, whether in armed forces or whether in civil setup. As Dr. Kalpana said earlier, I was trained at KEM Hospital and then joined military. But the only difference is there that most of our centers, except Armed Forces Medical College Pune, our clientele is purely defense and their dependents. It's only in Armed Forces Medical College we take civilians also. And though our primary role of protecting the country is never forgotten, I mean, that is the primary aim. And we support our soldiers who are fighting at the border, providing them the best healthcare which is possible.
And before we end this show, certainly I would want viewers to know the life of cochlear implant, because every patient who is investing in this would want to know this, because after all, they're collecting funds from here and there. It is an expensive surgery. So this question is there all the time in their mind. What is the life of the implant doctor?
See, actually, when the cochlear implant started, it started for adult patients. And the first patient who was implanted is still using the same cochlear implant. So it's about 35 years. And as we have, supposed to give you an example, if you buy a fridge, you have warranty and guarantee for 2 years, but it lasts you for a number of years. So same way for cochlear implant, for the internal implant, you have warranty for 10 years. And for external processor, you have warranty for 3 years. So as it for right now, though the warranty is for 10 years, the patients are using implant for over 30 years. But now we are doing more and more cochlear implant in children. So maybe in their whole lifetime, you may require to change the implant, and they may require another implant. So this is all the possibilities. But I have yet to see that the older implant is not working and you have to now change the implant. So the life of implant, the warranty guarantee is for 10 years and 3 years, but it lasts you for quite some time.
So I'm sure you've been seeing your children with implants growing up and even entered some good profession, right? I'm sure.
Yes.
They always come to say
My one of the bilateral implantee is into IIT Mumbai.
Wow, IIT Mumbai is wonderful. Powai. So this is a very good. Imagine a child with an implant, which means already a deaf child without the implant, and now doing IIT. It's brilliant.
He is doing all the work for deaf children only. His first project was how to make an alarm for deaf children, because the existing alarm was very bulky. So he took his first project related to his deficit, and who better than him understands his problems.
Right. So Dr. Renu and Dr. Hetal, thank you so much for being on the panel. And we'll let us formulate some points that we could send to the ministry level from IWOA. Let us do more and more screening, and let us request the government to enhance these kind of screening programs, etc., and giving more awareness about cochlear implant surgeries, etc. Always taking inputs from surgeons like you. So thank you once again. Thank you, Ketan, for giving us this opportunity. I'm sure the public has been enjoying this lecture.
Thank you very much for the opportunity given.
Thank you so much.
Before you sign out, I would once again thank all of you doctors who are present today on behalf of Series 5 TV, and thanks Dr. Kalpana Nagpal for making it happen. Thanks Dr. Renu Rajguru and Dr. Hetal Marfatia Patel for joining. And one last thing, last but not the least, using a cliche here, is that this is an initiative for public health education and food for thought for young medical fraternity for common ENT ailments and their management. We are going to have more such sessions soon. So for all the listeners who have been live or who will listen to this session later on, please like, share, and subscribe on our platform so that we can bring more such interesting sessions for all of you viewers. Thank you.
Thank you.
Thank you all.